Hello and welcome back to What's on Your Mind podcast. Um, Today we are going to talk about what to expect when you come to therapy for the first time.
Mhm.
Uh, Specifically, what to expect when you see a on your mind counseling therapist, as well as some preconceived notions that clients will sometimes come to us with. So,
Yeah.
Tori, you wanna
Start us off? Sure. Well, you and I were just talking this morning briefly about people coming to us and wanting to know what to expect. I think we're getting a lot of people interested in therapy, which is amazing. But they don't know how to prepare themselves. They don't know if they need to do any work beforehand. So this episode, I think, is going to be really helpful to help newcomers to hopefully ease some anxieties and help in that transition of seeking out help and realizing that maybe it isn't as scary as you thought it was going to be. So.
Exactly.
Cassandra, you were saying that some people, some potential clients come to us and they're thinking therapy is like what maybe you see on TV, like laying on a couch and spilling your guts, and you got a therapist on a chair with a notebook or something, jotting things down. Um, it's not like that, is it?
No.
Not at all.
I don't think it's been like that for a while.
Even though psychoanalytic therapy is still a thing, I
Yeah,
think that
definitely.
the way it's utilized is very different.
Yeah, exactly. I mean, I think of, just even how our setup is where we're virtual versus being in person, and how, you know, in person can be great. Um, you definitely have the like squishy couch that you
I
can
was
sit
gonna say they'd
on.
have a couch.
They do have a couch, but it's usually, or a chair, but it's usually a comfy chair to make you feel comfortable, not like, hey,
Exactly.
lay down and tell me, how this,
I've
tell me
never
something.
had that. Have you
No, no,
ever had someone actually lay down?
no, I have not. No, but I have had, when I first met a client and they had never had therapy before, um, them asking questions like that, when I have asked like what does therapy look like, or what do you visualize therapy to look like, and their first thought was, well, laying on a couch and you talking and analyzing me, or um
Analyzing, yeah.
yeah, a lot of that. And sure, I am, looking at what you're saying in your body language and all of that, but I'm it's not really like we're analyzing to find judgment. It's more like, do you notice, when you talk about this, that you tense up, right? Like just
Right. Noticing
things.
themes or patterns,
Yeah.
things that when you're in the thick of it, you don't notice that
Yeah.
having an outside perspective can
Yeah.
help shed some light on.
Yeah. And one thing I like to the sort of describe when I have a client that's curious about what therapy will look like or how it will look week to week is I saw it one time, so I can't credit the artist, but it was a cartoon of this giant ball of like different string, and
Okay.
you had the therapist pulling the string and just kind of just not deciding, but like pulling at certain strings to kind of unravel this giant knot, this
Yes.
huge ball of just string.
Yeah,
And
yeah.
I feel like that kind of describes therapy, because you have this client that comes in and they are like, here's my giant ball of strings, help. And my job is to look at that and go, okay, that seems overwhelming. Let's pull here and see what we get. Let's pull here and see what we get. Um, and of course, then you use, whatever modality you specialize
Exactly.
in to help with that. But I think it's just a good visual of your I, as the clinician, am getting everything all at once, and I'm starting to unpack it for you, starting to pull the strings to unknot it so that it makes more sense.
I love that. I'm so glad you brought that up. I too have seen a very
Yeah.
similar
Yeah.
image, but yeah, you reminded me of it, and I couldn't agree more. I think so many people come to us because they don't know where to start or they feel
Yeah.
stuck, right? Like they've tried to undo that knot themselves and haven't been as successful as they'd like, and and then we can help them do that. We can
Yeah.
help them untie that knot and maybe create something new, right? Like, okay, so now
Mhm.
you have all these strings and they're more organized, but what do you want to do? What do you want to create?
Yeah.
And really helping them achieve those goals.
Yeah. Definitely.
That's so
Yeah.
cool.
Yeah.
I got like a chill there for some weird
Oh,
reason. Maybe it just resonated. Or
just
I'm
needed it, huh?
cold. It's still bloody cold.
Yeah, talk about going from really warm to super cold was
I
very
know. Oh my
yeah.
goodness.
I guess that's
But
it.
yes, other preconceived notions. Like I'm just trying to think. What
Um,
else comes up for some folks? I think the analyzing one is a big one. Like they think almost like we're mind readers or something, or we hold some kind of like
it,
crazy ability
yeah,
to analyze or ugh,
it
I don't
reminds me
know.
of again another little like
Yeah, do tell.
I guess it would have been like a meme, I think maybe, but
Mm.
it was like when I tell people I practice psychology and they're like, "Oh, can you read my mind?" and then I and then they go, "No, I studied psychology, not telepathy." I'm like, "Oh,
Ah,
yeah, like I don't I can't read your mind, but I can, pick up cues."
that's
Um,
so interesting. People do have these preconceived notions of just
yeah.
psychology in general, right?
Yeah. Also I've found two different things. One, like I've worked with people who had seen therapists as teens or young children.
Okay.
And then they come back to therapy as an adult, and that is a very different experience for a lot of them. They don't know what to expect sometimes because it is a very different experience when you
Oh,
go
you
as a
betcha.
teen or a child, right? Like, because there's a lot more, usually it's a shorter session as someone who has worked with kids. Like, it's usually shorter.
Well, their attention span is
Yeah.
often shorter too.
Yeah. There's usually I've found, and this may not be true for other therapists, but I found when I worked with teens and young children is like you almost have to lesson plan a little bit. Whereas in therapy with an adult, it's more their leading, or you know what I mean? Like it's not like, okay, here I've this is kind of we're gonna use the game Uno to talk about our feelings, right? Like we're talking in general.
Right.
So that
I
is a
think what you're
different.
saying is like there's more like play therapy based
Yeah.
things with younger
Yeah,
people.
you're using a lot of like, maybe imaginative play or um kind of like a third source to help tap in
Yeah.
what they're feeling and thinking. Um, so which that's fine. And I have used a little play therapy with adults before, but it's not like it's not like every session is that. And so I think if you've only experienced therapy as a kid or a teen, that is a different, you don't know what to expect, and I think that can be a little nerve-wracking.
I think you're so right.
Also another one, which is my least favorite, is when a client comes in and they're not sure what to expect because of experiences they have had with client or with therapists in past. Whether
That
that,
haven't gone well.
yeah, whether that I a lot, I've actually probably a lot, like too many people have told me about having a therapist who talked about their problems in therapy. So it became more of like either like a friendship or like they felt like their therapist was talking about their issues.
No way.
Yeah.
Interesting. That
Mm,
always really bothers me when I hear people having such a negative experience. I mean, it's also really amazing that people are still trying to find help, even
Yeah.
though they've had such a negative experience. I always tell folks, well, I shouldn't say always, but often in consultations when I'm just meeting a new client for the first
Yeah.
time, one of the questions I ask is, have you seen a therapist
Yeah.
before? Have you been in counseling before? And if they say yes, I often ask, like, well, what's your experience been like? And some people will say horrible things, and
Mhm.
then I really make a point to say I am so like happy you haven't given up on all of us. Like you haven't written the whole profession off and that you're still seeking out guidance, and I'm super mindful of that moving forward in that relationship.
Yeah, definitely. Yeah, and just also, I always like to add that, if at any time you don't feel like we're a good fit, like just let me know. I'm more than happy to help refer you.
Totally.
I'm more than happy to like because I want you to get what you need out of therapy. And if it's not me,
Exactly.
it's not me. That's okay.
We
Um,
can't be the right fit for everybody.
yeah, and that's one thing I also when someone is new to therapy, like to say that I like to say that, but then also mentioned that, you might have to shop around for a therapist, and that's okay. Like every therapist has a little different of a style.
That's right.
Not every client is going to feel comfortable verbalizing what they need in therapy or like, hey, I didn't really care for the homework. Can we maybe do more of this? Or, you
Exactly.
know, not everybody can do that. And, that's why they're in therapy sometimes is because they're trying to learn how to advocate for themselves. Um, and so that's hard to do that with the person that's you're coming to help or coming to
Two
for
for
help.
help. Yeah.
Um,
I often really encourage that as well. Just like we need to have a transparent relationship. Like,
yeah.
I can't read your mind, you can't read my mind. I'm going to try and help you the best way I know how.
Yeah.
But if that is not what you're looking for, like, please tell me so that we can shift gears. We can do something different. Please don't just like continue on and not get what you need out of this. Um,
Yeah.
and I find people like they just relax. Like you can
Hmm.
see their shoulders just drop and be like, "Oh, you mean I have say in this?" It's,
Yeah.
yeah, this is all for you.
Right.
So we need to work together to make sure that this is what you need it to be.
Right.
Yeah,
Yeah.
so cool. So yeah, those are some preconceived notions. We kind of got off on a tangent there, but I thought that was important.
No, no, definitely.
Anything else come to mind for you for things maybe people come to us that just doesn't really fit?
Um, I mean, I'm sure there are more. I
I
just
know,
can't
right?
can't think of it at the
I'm kind of
moment.
like stumped too. I'm sure after
Yeah.
we finish this, I'll think of a
Yeah, it'll be like a
bunch.
long list
But
of things. Like, oh, there was that. I do think a lot of it too is dispelling what people see on TV or
yeah.
in the movies and how even just like confidentiality, like how that looks.
That's a good one.
Um, yeah. And trying to, having to kind of explain what that looks like, where the limitations are. Um, like I don't know about how you are when you watch a show where there's a therapist,
Oh
but
my goodness. I was just
but
going
I,
to ask you that.
I get so annoyed and I'm just like, that is not what you would do as a therapist.
I hyper focus. And like some shows are actually pretty good.
Oh
Can't
yeah,
even
some shows are
tell you
great.
what ones or like when it comes up. But I'm like, oh, they're actually asking a really good
Yeah,
question.
yeah. But it's usually, I don't know about you, it's usually like Law and Order that gets it really bad. Like they're just horrible. Like it's always like the police officers will come to the office and they're just like, hey, we need this information on this person. And then she's or he is just like, okay, what? What? No, no warrant, no like nothing. You're just like, okay, sure.
Yeah, no. No,
I
no,
mean,
no.
again, it's for like the storyline to progress, but like
Well, of course, yeah. But
other
I
than
think that's like tricky. That really does confuse
yeah,
the common person, the
yeah,
consumer, right?
yeah,
And could prevent someone from seeking out help. And that's
well,
really a shame.
Yeah, and there was actually, funnily enough, Scott and I Scott and I just finished watching the Lethal Weapon movies. Did you ever watch those?
No.
Okay. Well,
Should
it's
I?
it's okay. It's not my favorite. We liked them as kids, and so we were
Okay.
trying to see whether it held up or not. It did
Ah,
hold up. But the point I'm making is that it's a cop drama, basically, or cop adventure, whatever. And there's a therapist that's like a therapist for the precinct,
okay.
and constantly she's just like, hey, so and so, I think you really need to come and see me. I think, we need to talk about this after like experiencing this huge, like traumatic thing.
Right.
And they're constantly like brushing her off and all this sort of stuff. And I just found it really interesting how it was like, wow, even in this, like it spanned from like 1989 to like 99 maybe. I think
Okay.
that was the last one that came out. Where it's just like, wow, just if you were watching this, not that you'd maybe be thinking about therapy, but like how quick we are to portray in that experience. Therapy is kind of this, well, like, no, 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 like this is, you should be a tough person. You
Yeah,
don't
I'm
need it.
strong enough. I don't
Right,
need
yeah.
it.
Like, no, no,
Even
this is
in
when you really need
crisis,
it.
even when you've experienced this huge trauma, you've seen
Yeah.
someone die, or,
Yeah.
you've been through a
Right.
huge trauma, you don't need it.
Right.
Yeah, okay.
It made me think of that while we were talking about that. I was like, wow, that's interesting how even just TV shows will not only just get the process of being a therapist wrong, but then just perpetuate why someone would need therapy or
Mm,
when someone should definitely get therapy. Uh,
yeah.
but yeah.
I don't know if you've had this. I'm sure you have because you're so great at what you do. I had a client the other day who had never been to therapy before, and so it was a husband and wife, and the wife had been to therapy before, more on an individual basis, and the husband had not. And he, after the session, like I had checked in and, just asked them what they thought and just like a little bit of feedback too for like subsequent sessions and making sure that we honed in on what they wanted to and they got what they wanted out of it. And the husband said, I really enjoyed the session actually, and it's really like opened my eyes to therapy and what it can
Aw,
be. And I'm actually excited to keep doing this. And
aw,
I couldn't tell you how amazing that made me feel. Like,
yeah,
just that he was so vulnerable. He came to therapy, a new experience,
yeah.
and just like was open about it, and then like just realized that it was a whole new avenue to seek help, and that he
Oh,
was upset that they hadn't tried it sooner. And I was just
aw.
like, oh my gosh, like this is an
Yeah, that
amazing
is really great.
feeling. And I
That's
just wish
awesome.
more people could have that feeling.
Yeah, I know. Yeah, no, that's really wonderful when that happens. And
Right? Doesn't it
yeah,
make it all worthwhile?
yeah.
Like that's those moments where you're like, okay, this is why I'm doing this.
Like, okay, okay, so we're
All
here.
right, it's kind of worth it.
Well, I do find that with couples, when I'm working with couples, it's a different experience than working individual for various reasons.
Well,
But
of course, yeah.
but mainly when there's it feels like for with a couple dynamic, when there's a breakthrough, there's a really a breakthrough.
You like feel it.
And you're like, okay, we're good. Like there are and it's usually after like several sessions of just being like, I don't know if we're gonna make it, guys.
Like we're just like kind of
Like,
hitting a brick wall
yeah.
almost.
Like, are we good? And then suddenly it's just like this light bulb moment, and you're like, wow, okay, thank you. Good job, guys.
Oh my
I do
goodness.
remember that I did have when I had a couple who they were able to have a discussion about something without just sort of spiraling out into all of the like four horsemen and all of that sort of
Totally.
stuff. And like I started clapping. Like when they were done, I'm like, guys,
Have you ever
did
teared
it.
up?
Yes, yeah. Like I was
I've
tearing up and I was
totally teared up.
And
Like,
then
oh
they
my
were like, I don't
gosh.
think I've ever seen you be so smiley. And I'm like, yeah, because you guys did it. Like, you should feel so proud of yourselves. Like,
Oh, I say that all the time. You should be so proud, or like, that
yeah,
couldn't have gone over any better,
yeah,
or things like that. And just like
yeah,
really calling it out to make sure people know that they're doing good work. Because it's
yeah,
hard sometimes.
yeah, of course. Well,
Yeah.
and I think it's even more difficult when it's like in a couple dynamic where, especially if they're used to kind of, oh, well, I need this therapist to hear my side of it so that they're on my side.
Oh my goodness, I don't
That
like that.
dynamic. And suddenly you're like, no, no, I'm not on anyone's side.
Hmm.
Both of you have valid perspectives. Let's try to get back to
Let's
that.
work together.
Right. So,
Yeah, maybe that's another good misnomer is that especially for couples therapy, that the
yeah,
therapist will choose who's right and who's wrong, and like they'll pick a side and they'll have favorites. And us at On Your Mind Counseling really try not to do that. And myself as like an exclusive couples therapist,
yeah,
I say I'm, partial to both of you, or I'm impartial. Or I say I'm on the relationship side. Like
right.
that's usually what I say. I'm advocating for the relationship, whatever is best for the relationship. So if that means one of you needs to do something better and the other needs to do something better, like that's what I'm going to say. And I
Right.
think that's what people really need to hear,
Yeah.
because they're stuck in their own patterns. But yeah,
Yeah.
that's a big one. People thinking, oh, the therapist is going to, they need to hear me and they're obviously going to side with me.
Right.
No,
Yeah.
you both have valid perspectives.
Oh, another one has just sort of popped into my
Oh, they're
brain.
coming up.
I know. Look at us go.
Keep going.
Um, um, but I was gonna say that one that pops up when someone is new to therapy and like new to therapy as well as like their family is new to therapy is the fact of like, oh, well, is my diagnosis or is what I'm feeling real, right? Like, is it valid? Like, because
Mm,
my family is telling me depression isn't a thing or anxiety isn't a thing. Um, so is this like, I don't understand like that sort of like not understanding how therapy will help if supposedly depression and anxiety isn't a thing. Like I've had clients who've been like, yeah, my family doesn't think depression is real. Like I years ago now, I had a teen client who uh, I had to talk to the parents and explain what depression was because their teen was extremely depressed. And they're like, but once they understood that it wasn't like I don't know if there's, I'm not really, I don't know if it goes back to the like, oh, we don't see mental health as a
I think there's
thing.
still a stigma. People don't
Yeah.
want to acknowledge that they have a thing.
Yeah. So that is one aspect that I do definitely see occasionally. Not as much anymore, but when I was first starting out, I definitely saw it a lot.
Hmm. Yeah. Well, this has been a good like discussion. I think we should like slightly pivot, just maybe talking
Sure.
about what to expect from like a
Yeah.
consultation. Maybe we can start there. Time is just like rolling by here.
Yeah.
We're just so in it. I love
Yeah.
it. So at On Your Mind Counseling, we do offer a 30-minute complimentary consultation for clients to get better acquainted with a counselor. Something that I think is relatively unique about us is that you as a potential client will be meeting with the counselor that you potentially would be working with. It wouldn't be an admin person who is trying to fit you with the right person. It would actually be the counselor you'd be working with. So that's huge. It's 30 minutes too. So that's I think it's a good chunk of time,
Yeah.
although I find they too move so quickly. Once you kind of cover everything that you want to cover. And this is just from a therapist perspective. There's so many questions to ask and things to familiarize yourself with. But I thought maybe we could just talk about what a consultation could look like.
Sure.
Um, so, Cassandra, maybe I'll just start and then you can chime in wherever. Um, So our consultations are set up very much just like sessions so that you can get acquainted with the platform. So we utilize Jane, which is a Canadian company based out of Vancouver. It meets all of our security requirements we have to meet. And it's a virtual video call. So just like our sessions, so is the consultation. So you get to really see what it's like and familiarize yourself with the platform. It's an opportunity to like iron out any kinks that you
Yeah.
notice. Like if your device is needing like some permissions enabled to
Yeah.
access your video or your microphone. So that's just a nice way of doing that so that hopefully when you get into actual sessions, like you don't have to worry about that, right? You can just show up and enjoy the session and do the work. So yeah, you familiarize yourself with the platform, of course, but then you can expect the therapist on the other end to greet you and to get curious with you. They may cover some logistical things like confidentiality and just like things like that, things that would be in a consent form. I don't typically do that as much. I probably should. But but yeah, is there anything, Cassandra, that you cover in way of like logistics in the very beginning of a consultation?
Um, yeah, I usually break it up into two sections. So like the
Ooh,
first
okay.
so
Tell
the
more.
first section is, I'll just introduce myself and then
Right?
give them a little bit of a background on, my specialties. And then I briefly talk about like, okay, this is what billing would look like. This is what scheduling would look like. This is, if I at that point give them my email in
Do
case
you start with all that?
yeah, yep.
That's interesting. I end with all that. I
Well,
do it the other
I
way.
usually actually give them a choice. I say, okay, so I have a spiel that I give, and then you're gonna tell me whatever you need to tell me about what's happening. I don't usually say it like that, but that's the watered down version of it. Um, but I say, would you like me to go first or would you like to go first? And
Oh,
then,
okay.
usually they'll say, oh, you can go first. And I usually call it like housekeeping. Like this is just
Yeah,
basic housekeeping stuff that I'm just
it
gonna
is.
go over. Um, but yeah, so then I usually go over it and I also let them know if at any time they have questions, please interrupt. It's totally fine. And then yeah, so then I'll at that point give them my email and say, this is what rescheduling looks like. This is I'm willing to work with you, but you got to communicate. Like I try to make that pretty clear, like, hey, you got to communicate with me if there's a scheduling thing or something like that. Um, and then I mean, that doesn't usually take me too long.
No, 5 minutes.
Yeah, it's very quick. And then I will, sometimes that's when I'll get the question of, well, what does a session like look
Yeah,
like with
what does
you?
it look
And
like?
then I will talk a little bit about how, in our first official session, I do a pretty in-depth intake, which again is broken down. I like my steps of realizing where it's like I'll go over your mental health, your family history, and then we create a treatment plan. And then based on that treatment plan, I will pull on modalities that I use to kind of specifically help you.
Right, to address their concerns. Yeah.
Yeah. And that usually helps, comfort them or, they
Yeah.
usually feel good about that. And then usually at that point, I'm like, do you have any questions, concerns,
Hmm.
comments that you have for me yet? And sometimes there are, sometimes there's not. Um, and then yeah, then I'm like, okay, well, let's hear why you're coming into therapy today. And then yeah, that's usually
Just
either
like a
a
brief
short answer
overview
or a
of
really
that.
long answer.
No, I think that's awesome. I think it's important to hear. And I love hearing how people on our team approach consultations slightly differently. I think
Yeah.
all the components are there. It's just the order in which we do them
Yeah.
is a little bit different. Like I was saying, I typically take care of the housekeeping last.
Yeah.
The very beginning is just, like you said, introductions, making sure I can say their name properly
Yeah.
and I have their pronouns right and those types of things and then just asking them uh, Well, I think I give them the framework of what I typically want to cover. So, like, consultations are an opportunity to meet me and for me to meet you, and we can get acquainted with each other. And I want to learn a little bit about you and what brings you here. And I want to share a little bit about myself and how I work and what to expect. And hopefully, I can answer any questions you have. So I kind of just give them like a potential like tiny little agenda and just
Yeah.
ask them if that's okay with them and usually get the go ahead, right? And then I like you like it's so interesting that we do it opposite. I ask them like, so it's usually a couple with me, of course. So have you been to counseling before?
Right.
And what brings you in? And how long have you been together? And do you live together? And do you have kids? Like just those like very
Yeah.
high level things.
Yeah.
And sometimes they're coming in, well, often with like communication problems or conflict management. And just as like a preliminary question, I often ask, like, what are you noticing in terms of your communication or conflict?
Yeah.
Just because that's so broad.
Yeah.
So it gives me a tiny taste, and that usually goes on for about 5-ish minutes or so.
Right.
And then once hopefully they feel heard by me, I share a little bit about myself and how I work. And we talk about what potential next steps can look like, and then answer any questions they have. And yeah, that's kind of it. It flies by.
Yeah, it's very quick. Yep.
Yeah.
Yeah,
I don't
and
know how other clinicians do it in like 15 minutes. Like, how do other practices even do that?
yeah, I don't know. I mean, well, sometimes they're pretty short. I usually when they first come on, will ask them, "Hey, have you ever had a consultation
Oh, do
before?"
you? Okay.
Yeah. And then I say, it can be as quick or the full 30 minutes kind of.
Right. Again, giving a lot of like
Yeah.
flexibility.
Yep. And usually people are pretty quick, and I don't know. I've found that unless there is like a major thing, like they're in almost not crisis, but almost like some people, have kind of been building up to go to therapy, and then
Oh,
when they have
totally.
a
They got lots to
consultation, it's
say.
like this sort of the word vomit of everything that they've been feeling. And like that's fine. That's totally fine. And so that will take
Hmm.
us to 30 minutes. I also just think some people are much more talkative at
I
first
was just
than
going to
other
say that
people.
too. Some people are chatty and some people not so
Yeah.
much.
Yeah.
And that's okay. You're
Mhm.
right. Consultations do range. I think maybe I've just been so like routine with mine that like
Yeah.
the way I've set them up is to utilize the full 30, but some people they just, when you ask them questions, they're not as elaborative, or is that even a word? Elaborative? They don't elaborate as much,
There you
which is
go.
totally cool. It's fine.
Yeah.
Yeah.
Yeah, and I feel like what I like about the consultations is I do think that it gives you a good idea of whether you're going to be a good fit with the client. And
Yeah.
um I found it helps me prepare a little better for the intake
Mm,
with them the
yep.
next time. Opposed to like in past when I've had to just jump right into the intake.
Hmm.
Um yeah,
You
I
know
just
what to expect a bit more.
right. Yeah. I think it gives a nice buffer.
I agree with you. Yeah. Maybe just one last thought before we close here. People, I think some people who are brand new to therapy, I have been asked before, how will I know if it is a good fit?
Mm,
And that is such a good
yeah.
question because earlier we were saying we can't be a good fit for everybody. So how do you know?
Yeah.
Um, I think it's talking to someone and really asking yourself, do I think this person's going to get it? Do I think they're going to understand me?
Yeah.
Do I think that they're going to be able to like empathize with me and yeah, just kind of like have my back and get it. And if you feel like your therapist can understand you and you feel heard by them, then it's likely a good fit.
Right.
If you don't think they're going to understand it, if you think there's going to be way too much explaining needed,
Mm,
or like culturally we're too different,
right.
or there's language barriers, then yeah, like seek out a different therapist. That's totally cool.
Yeah.
Um, but that's something to keep in mind.
Mhm.
Do I think my therapist is going to understand me?
Yeah. Yeah, I think that that's really a great point. And I'd also add just, what do you want in a therapist um that you could like pinpoint, right? Like if you were to make a bullet point of your perfect therapist, what would those things be? Um, but also, like I like to think of it as your best friend, right? Like there are aspects of your best friend, your best friend, is able to listen to you and talk, and hopefully this is if this is a healthy best friend. We're talking about the good best friend, okay? um Somebody who you're able to talk to, like you said, someone who understands it, someone who knows when to push a little bit, and someone who knows when to maybe, use a little humor, or, like this sort of flow of like, a little bit of friendship, but like not, obviously there's a line.
No, totally.
There's
I think
obviously a
what you're
line.
saying is that they just get it and like
Yeah.
they're on your side and they are a good listener.
Mhm. Yeah.
Yeah. I love this episode that we're doing. It's
No.
flowed so organically. I think, today you and I had thought about a bunch of things to cover, and maybe there's a part two to this in terms of more about what a therapy session could look like or what you can expect, especially working with two therapists here who have slightly different approaches,
Yeah.
but you can see how things vary so
Yeah.
much.
Exactly.
Yeah.
All right.
Well,
Well,
until next time, I suppose. Is there anything
yeah.
else you want to say?
No, thanks for listening, guys.
Thanks
And
for listening.
we'll see you next time.